Laure Mogodalg. I am a M2 Life Sciences student at the CRI in Paris, which is the Center for Interdisciplinary Research, and I'm very happy to be here moderating with two really interesting people from the field, Dr. Ahmad Firdaus and April Brubok. So hopefully I pronounced your last names properly. So I will introduce both of the speakers who both have different experience in the field, but are also complementary because we have somebody working for government and somebody who's also a medical practitioner. So two different backgrounds, and it's going to be interesting to see how we can learn from these two distinct ways of working in healthcare. So Dr. Ahmad Firdaus is a medical advisor with the government of Malaysia and founder of Medical Mythbusters Malaysia. In 2016, Dr. Ahmad Firdaus, together with a team of healthcare workers from Malaysia, banded together and formed a group, MFRI, dubbed MFRI, to combat public health misinformation in the Malaysian community. In expanding on his vision of empowering the Malaysian public on health and medical literacy, Medical Mythbusters Malaysia is tackling medical and health misinformation on different social media platforms. MFRI's storytelling approach is refreshing and a more approachable and accessible version to the public compared to academic literature. Currently, Medical Mythbusters Malaysia has more than 250,000 followers on Facebook and collaborates with the Malaysian Ministry of Health to combat misinformation on mental health, tobacco control, and immunization. During the COVID pandemic, MFRI's Facebook platform was used extensively to enable reliable and credible information to be delivered to the public. Dr. Ahmad Firdaus plans not only to engage in social media, but also to engage in in-person community engagement. MFRI has started community engagement programs in villages all over peninsular Malaysia with the objective of educating the community on health, especially non-communicable diseases. Dr. Ahmad Firdaus has also completed the third cohort of infodemic manager training from the World Health Organization. So I think he's here with us. If you want to say quick hi before I introduce April.
Hello.
Okay.
Hi guys. Just a quick correction there. I'm actually working with the government and the Ministry of Health, and I'm not really advising, but I'm part of the core task force of these specific groups, mental health, tobacco issues, and also immunization.
Okay. Thank you for specification. Sorry. And then April, who we've already heard a little bit, April Brubok serves as the Deputy Director of Health Communication and Education at the US FDA Center for Tobacco Products. A strategist and health communication professional, her portfolio includes oversight of the FDA award-winning tobacco prevention campaigns. At the onset of the COVID-19 pandemic, April was recruited to establish and direct the U.S. Department of Health and Human Services COVID-19 public education media campaign, which included disseminating information about the vaccine development process, countering misinformation by proactively answering common questions, and tailoring messages for those in populations or geographic areas with high infection rates. April also served as the deputy for the FDA's COVID-19 Joint Information Cell, coordinating FDA's communication response to the pandemic. Before her career at the FDA, April was a cancer research fellow and communication program manager at the NIH National Cancer Institute with a focus on tobacco control and technology, including smokefree.gov and mobile health initiatives. She holds a master's in communication from Johns Hopkins University, a bachelor's in psychology from the University of Maryland, and was a doctoral student in global public health leadership at the University of Indiana, Purdue University. April is also a graduate of the FDA Leadership Program, which includes a certificate in executive leadership from the American University. So we're really excited to have both of you here. The way this session, which is going to be lasting until 3, is expected to work is we're first going to have April present some of her work during 20 minutes so we can get, an overview of what exactly you've been doing in the field. Then we'll have a few, let's say 10-15 minutes direct questions to April before Ahmad presents his work for same 15-20 minutes. round of questions directly to you. And I think it'd be lovely to end with a 20-minute discussion where we can learn from one another and actually leverage on the fact that we have professionals from different countries, slightly different expertise that can probably cross information. And please drop your message, like your questions in the chat, or keep them for after and open your microphones. Okay, April, I think you have the ability to share slides normally.
Okay, let's see.
Okay, amazing. Thank you.
All right, looks like it's working. You can see that?
Yeah, looks great. Thank you.
Okay, good. So today I'm going to talk about preventing vaccine misinformation on social media in the US. And this is from a public health practice perspective. There's actually a lot that organizations and governments and even individuals can do, but this presentation is more focused on the public health practitioner. And my email address is on this slide. If anybody's interested in reaching out after the presentation for more information or just to chat. So today I was going to review just a basic overview of social media use in the US, as well as social media and the connection to vaccine misinformation. I'm going to provide the US example, or a US example, of preventing COVID-19 vaccine information on social media, and then have a little discussion about how public health professionals can prevent misinformation. And I also included a slide with references and further reading. There's really a lot of very informative and interesting literature coming out in this space, especially in the last couple of years, that I think is worth doing some additional reading on. So in the US, this is as of 2018, so it's likely increased since then. About 7 in 10 Americans use social media. And these data are from the Pew Research Center, which is an incredible source of all sorts of data and facts in the US. Young adults, I think we all know, and kids use social media at very high levels. But as you can see from this slide here, the use by older adults and older adults continues to increase over time. And the primary platforms that people use, which are ubiquitous, are YouTube and Facebook, but there's also many other sites with very sizable populations communicating on them. I think folks are probably all familiar with most of these anyways: Twitter, Pinterest, Instagram, TikTok, Snapchat, Reddit, WhatsApp, LinkedIn, and then at least in the US, I'm not sure if it's international, there's also Nextdoor, which is a sort of a neighborhood-based, geography-based social media app. So there is evidence actually that people who get their information from social media are actually more likely to be misinformed or hesitant about vaccines. And those who primarily consume traditional media are less likely to be misinformed. So although a sizable amount of the population uses social media, it is associated with a greater degree of misinformation. And in the US, in terms of misinformation on vaccines, there's actually a very specific group of what I would call bad actors or super spreaders. So there are what the Center for Countering Digital Hate has termed the disinformation dozen. There's 12 anti-vaxxers who are responsible for almost 2/3 of the anti-vaccine content on social media platforms, which is quite amazing, but then also gives us a clear kind of target in terms of kind of assessing the messages and the narratives that anti-vax individuals and organizations are generating and sharing. And then the themes around the narratives for vaccine misinformation are fairly standard over time. And Tara Smith in 2017 developed a taxonomy where, which actually most pieces of information kind of fit into. And this includes toxicity, claims that vaccines are have toxic or unnatural ingredients, religiosity, so claims that vaccines have ingredients that would make for religious objections, notions of liberty, that authorities, don't have the right to put or demand that you put anything in your body, distrust of industry, which is largely focused on ideas that industry is focused on profit versus focused on health. Notions of safety, claims that vaccines are either untested, under-tested, or have, the risks far outweigh the benefits. And then conspiracy theories, largely that there's a malevolent force trying to, spread vaccines and related damage. And for, COVID-19 vaccines, that has included conspiracy theories about, for example, Bill Gates and microchips, population control, and then just other hidden dangers. And this, the graphic here is a report by the Center for Countering Digital Hate, which is a very interesting read on the disinformation dozen, including kind of a deeper dive into each of those bad actors. So related to preventing COVID-19 vaccine misinformation, I was going to provide the US example, or a US example. So at the onset of COVID, there was this urgent need to educate the public about how they could prevent the spread of the virus and reduce related disease, disability, and death. And one strategy to achieve this is based on the evidence that science-based public education media campaigns can create behavior change. In this case, that would mean mask wearing, social distancing, and vaccination. So in response to this, the US Department of Health and Human Services COVID-19 public education media campaign was initiated in July of 2020. And for that first year, I served as a program director. And one of our initial strategies for the campaign was very much a social media and search strategy we called Preparing the Nation. And this is where we provided targeted information, essentially answers to questions via trusted messengers or via interactive video to help people get the information they needed to feel confident about vaccinating against COVID. And this, the link here is the website for the campaign, and it actually has a lot of downloadable and shareable resources and social media clips and toolkits and all sorts of good information related to COVID-19 public health steps. So in a very kind of simple way, I wanted to outline our process for preparing the nation. And the initial step is identifying frequently asked questions, as well as monitoring for more information. So given in this case, for example, vaccines were new for COVID, obviously, reasonable people could have a number of questions about them. And so we use both social listening and Google Trends and keyword data to understand the questions that people were asking, and then to really look at who's asking the questions, what are their audience, what are the audience's characteristics, and who are the most appropriate or relevant trusted messengers. And the trusted messenger piece, evolved over time. Initially there were leading scientific advisors in the government who were serving as trusted messengers, but over time, because of the politicization of COVID-19 in the US, those messengers became not less trusted, but more of a, for those who were opposed to vaccination, they became more targets for them. So we really looked more deeply into local trusted messengers, community trusted messengers, testimonials, and the like, to find kind of to keep refining the idea of who trusted messengers are for these topics. And so then we would craft responsive messages, or essentially answers to the questions, that provided both accurate information, but importantly in plain language. So when you're looking at a national campaign, you're dealing also with a lot of people who have lower health literacy levels, and a lot of the content around COVID-19 is very scientific and often sophisticated and inaccessible to lay audiences. So it was really important that the answers or the messages be provided in that plain language that was accessible by lower literacy populations. So then we would move to produce and place social media content in a timely manner to address current questions. And the placement included across owned, earned, and paid placements. So owned means on your organization's social media sites, on their handles that you control the content of. And then earned is how you might work with partners to disseminate your posts and to further amplify them. And given this was a national paid media effort, we also put significant funding behind amplifying the messages on various social platforms through paid advertising. So that is sort of the process. And then we would continue and do continue to track performance of the ads to learn about which ads worked better, more shareable, more likable, more comments, less confusing, and then integrate those lessons into our process. And just for high-level metrics, to date, we've generated almost 1 billion social media impressions, and there's actually a rigorous outcome evaluation that's underway for the campaign that includes the strategy to demonstrate how the campaign drove vaccination rates within the US. So as an example of this process, early in the, once the COVID-19 vaccines were available, a lot of questions arose about fertility. Women who were planning on getting pregnant, who were pregnant, had questions about, would this vaccine affect my fertility in any way? And as we picked up signals via social listening, and also, as people are talking to patients and NGOs and other groups, like those are other methods by which to, pick up those early signals, we understood that we needed a plain language, response, that came from a trusted messenger, and we actually worked to promote several different videos that address this. And I think this one is a good example of how you can get out there when you have the, when you identify the question, you can get out there with information that can essentially help to inoculate the public from misinformation and rumors, if you can get kind of ahead of the game. So now I would like to share this video, and hopefully the sound will come through.
The sooner you get vaccinated, the sooner you and your baby are protected. And it doesn't matter if it's before you become pregnant, when you're thinking about it, or in your first trimester, second trimester, or third trimester. Really, what we want is for you to be protected.
Okay, let's see if I can move on from this. There we go. Okay, so then that was just, an example of how we find out the question. We produce a plain language, pithy response, get it out into social before any type of misinformation begins to spread. So what can public health professionals do in terms of preventing vaccine misinformation? And this could be even on an individual level, but also on an organizational level. And I think the first recommendation would be to establish a process that is repeatable. And I have an example here from the Stanford's Virality Project of a rumor control process, which is similar to the process we ran for Preparing the Nation. So essentially, in this case, it's detecting the rumor and that it's there's enough of it to respond to, and then publishing the fact, amplifying it, and then measuring a reaction. So in our case, it's similar to what I described in sort of being data-driven, but in our case, I think the notion is in terms of prevention, it's how can you be proactive? How can you get in with accurate information before, the misinformation or the rumor spreads? And so that notion is one in some academic papers termed pre-bunking, or to pre-bunk, which is essentially considered an inoculation method, a communications inoculation method. So if you can provide sound, accurate, accessible, salient answers prior to the spread of misinformation, when that misinformation does spread, individuals who received the inoculation are less likely or less susceptible to that misinformation. So the next idea is to focus on what we would call the movable middle. So there's people who, with the case of COVID-19 vaccines, who are vaccinated, ready to get boosted. They understand and appreciate the protective effects of the vaccine. Then there's those on the other extreme who have no intention of ever getting vaccinated and may in fact, be perpetrators of kind of misinformation around the vaccines. But there are people in what we would term the movable middle who are in between those two groups, who may have valid questions and concerns, but until those are answered, they remain susceptible in some ways to misinformation, which might lead them not to get vaccinated. So kind of focusing on the movable middle and their questions is what we would understand to be the, where the most return on investment is. And then as we've messaged, as I've mentioned, partnering with trusted messengers, now that can be community organizations, doctors or nurses from local communities, or those who represent populations at risk. Testimonials are also often considered to be trustworthy and credible. So I think, if you're with a health institution, it's often good to let either, the frontline workers or the frontline community members be the messenger in terms of answering questions on social. So the other idea is to collaborate with communication experts, because all of us likely use social media, and we may find ourselves to be, skilled at it, but there's really an expertise that comes, for example, in translating complex science for lay audiences, and preparing kind of content for social media that is understandable and shareable. So that coordination with health communications colleagues, I think, is really important. And then, expanding reach can mean a number of things. It can mean working with partners to amplify your message. It can mean putting some paid resources behind the amplification of your message. But I think a regular engagement on social media with the audience on this notion of answering questions is also something that can essentially grow your audience over time. So these are the references and further reading. A lot of these are so interesting. I would recommend, if you have a chance, to check out the Vitality Project, Memes, Magnets, and Microchips, discusses the narrative dynamics around COVID-19 vaccines, and specifically a lot of what's happening on social. So I think that's just a great resource and a fascinating read. So that is my presentation for today. Thank you.
Thank you, April. I think that was very interesting and yeah, very complete. Maybe we'll ask for the slides later so that the participants can look back to them during their session.
Oh, yes, of course.
I don't know if there are any questions in the audience. If anybody wants to raise their hand and open their microphone up. Any specific questions?
Yeah, thanks so much. I have a question. And it's actually, do you think firewall on websites and blocking fake news and accounts on social media that disseminates information on vaccines is necessary? And what strategy do you think is the most challenging in performing your campaign, and how did you deal with it? Thank you.
I think I missed the first part of your question. I'm sorry.
Okay.
Could you repeat the first part?
Yes. Do you think firewall on websites and blocking fake news in accounts on social media that disseminates misinformation on vaccines is necessary? Thank you.
Okay, thank you. Yeah, I think there are a lot of these kind of references, further reading that I shared, make very strong recommendations that the platform owners, be it YouTube, Facebook, Twitter, TikTok, have a responsibility to identifying, for example, the bad actors that are responsible for the majority of the anti-vax sentiment, that they be essentially deplatformed. So I don't speak, you know, from with my government hat on, but I would say experts in the field feel strongly that everybody, you know, has a role to play, and the platforms themselves should be responsible for helping to identify and deplatform bad actors. So that's sort of the first question you had. The second one, what has been most challenging? I think for us, for me, in my opinion, the most challenging dynamic in the US in terms of addressing misinformation is that the politicization of COVID-19 vaccines and prevention measures have really, it's been such a struggle. So there's a lot of evidence, including I think a study I posted in the further reading section, that the strongest predictor of vaccination, COVID-19 vaccination, or the strongest predictor that a person would not be vaccinated is their political affiliation. So that overrides essentially everything else.
Yeah, that's true.
So even if you're trying to make a evidence or information based message about, you know, how, for example, COVID-19 vaccines prevent, you know, essentially almost all hospitalizations, or very high percent, you know, any message about COVID-19 is seen for those folks through a political lens. So, you know, it's just, we still work, you know, diligently with the movable middle, but there's this intractable, you know, group that it's very tied to political ideology. And I don't think anybody's quite figured out how to crack that nut.
Thank you.
Thank you. There's a question from a participant which actually rebounds on that a little bit, asking how can the government rebuild trust in the health sector through social media? Do you feel that the public has lost trust in the government, which you were already alluding to? Do we have tangible solutions? How do we rebuild trust? On that note, I was also wondering, when you talk about trusted messengers, you also talked about, like, you know, community-based interventions, etc. Would it be more effective to focus, that the government focuses on funding these people rather than funding social media, where, you know, parts of the people online are already slightly lost, and it's probably not worth investing time and energy there? Sorry, I hope that was clear.
Yeah, so I guess that's a two-parter, and I think, you know, public health professionals in government across the world are seeing a lot of erosion of trust in government with the rise of different kind of political ideologies. And I think it has been an ongoing challenge for how to increase trust and credibility. I think there is no easy answer. I mean, along with trust in government is also sometimes trust in science, trust in evidence, and, you know, people are uncomfortable with uncertainty largely, but, you know, that is kind of part of the scientific process. So I think, you know, when we talk about trust in government, and I do link it to also trust in science, I think some of it, you know, it relates to education, meaning literacy around media literacy, critical thinking, other types of skills that, especially in a digital world where you're flooded with information, how people can use kind of critical thinking to determine what is, you know, what information can then be competent about and what can they reject. I think also in government, I think as best we can to separate the political, for example, from public health is ideal. And so there are, I'm sorry to say, there are like no easy answers, but a lot of it is, I think, linked into kind of political theory and how people sort of identify politically and whether that then aligns with the notion of trust in government or not. And then your other question was, oops, I've lost the thread. What was your other question?
It was a bit lengthy.
Oh, yes, no, I remember. So I think your other question was about, should government continue to do kind of, I guess, social media directly, or should they fund the community groups, the trusted messengers? So I think the answer isn't one or the other. It's both. And that's what happens, at least in the US. A huge amount of funding goes to states to use kind of on public health measures, including COVID-19. And then there are some, of course, national federal efforts like the COVID-19 campaign. And again, that is undergoing a rigorous evaluation, which will demonstrate a very high return on investment. There's some things you can do at a national level that become more cost efficient, but yes, absolutely, you still, you need to, equally invest in on the ground, community-led interventions and information, not just sharing, but information generation as well.
Sounds great. So no other questions from participants before we move on to Matt?
May I chime in as well to the discussion? With regards to the role of social media in misinformation, there's a limit to how far we can go on social media because there's some segments, I think it happens all over the world. There's a certain segment of the community which uses internet, and there's another segment which they don't use the internet. So these people would need what we call as a whole of society approach, whereby we need those people from the ground level, the nurses working in the community, to become champions there by not using social media, but using being present at that point in time to entertain all these questions.
Yeah, good point. There's a whole, there are people not on social media, so we need to make sure we're reaching and supporting them as well.
I had one last, maybe more technical question before we move on to Ahmad's presentation, but the video you showed was from the CDC, I think it wasn't, and if I understood well, you worked with the FDA. So how did these two entities collaborate during the crisis, like how in terms of communication?
Sure. Yeah, I was actually on loan from the FDA to the Department of Health and Human Services, which is the umbrella agency under which FDA, CDC, NIH, other organizations exist. And so actually that particular ad I showed was a collaboration between the Kaiser Family Foundation, so that's NGO, and HHS. So we were not opposed to if we found an ad in the environment that we thought was suitable for example, the question we needed answered, we didn't feel like we needed to go create it anew. So we partnered with a variety of NGOs and other organizations. We created our own content, but we also partnered with others to then amplify and share their content. So that ad was an example of that. So at HHS, because they are the kind of umbrella agency, we coordinated the campaign there, which included having points of contacts and not just points of contact, but regular communication, strategy meetings, review meetings with experts at CDC, FDA, Center for Medicaid, Medicare, all the various health agencies within the US federal government So we had sort of like a collaborative that we would go to vet and review all the various strategies that we had in place. So the notion was, instead of having the campaign placed at one of the secondary kind of agencies, was to keep it at the department level so that we could benefit from all of the collective expertise.
Okay, that's very interesting. And because people, relate differently to the label used, like, I don't know, maybe FDA has, I don't know the US system well, but maybe less good reputation than the CDC for reasons. Like, did you stick to a certain labeling, or it was just whatever let's say Tucker had created the video, the label was reused?
Well, in the US, the credibility of the various agencies may be different than like the international perspective, but we essentially used the Health and Human Services, the HHS, the "we can do this" as sort of the, the label, but then we didn't want to create too many different kind of web call to action websites. So we largely focused on sharing the CDC web information, and again, we were trying to work hard not to duplicate efforts. So if we already had all the content on cdc.gov, then we kind of focused on that. Over time, it did evolve to a vaccines.gov, but the labeling was largely to try to, I guess, marry it with like a all of government kind of health response versus an agency health response. But the website was largely, or the call to action on a lot of the ads was specific to CDC, because that's where the content was, and we didn't want to recreate it just for a different labeled URL.
Okay, great. Well, thank you a lot for all this insight. We'll go back to chatting after Ahmad's presentation. Ahmad, do you need to share slides?
Yes, I'll share my slides.
And please feel free to drop any questions in the group chat, or privately if you'd rather.
Okay. Hello, can you guys hear me?
Yes.
Okay. So first of all, thank you so much to the WHO Paris team for the invitation. Everyone here, thank you for your time and effort to come over this weekend to attend this excellent event. So I won't take so much of your time. I think I would focus more on the discussions later on. So I'm Ahmad Firdaus Muhammad Haris from Medical Mythbusters Malaysia. This NGO is actually my side job or side effort. I'm actually working with the government. I'm a healthcare worker, healthcare staff with the Ministry of Health. My task is mainly on the non-communicable diseases. So for those of you who were born in the 90s, there's this term, there's this quote that we all used to listen to. If there's something strange in your neighborhood, who you're going to call? It's by some person called Ray Parker Jr. So this is what people associate with busting. Usually it's called Ghostbusters. So for us, for those, the sound is too loud. But for those who are in the 90s or in 2000s, this is more familiar. So instead of us being Ghostbusters, we are actually more towards the Avengers of the medical field in Malaysia. Why Medical Mythbusters is Avengers? Because we debunk medical myths that's been circulating online. So this is our current up-to-date status or our updated Facebook page, whereby we have 244,000, nearing 250,000 followers, and it's growing. So we started off in July 2016 with 50 healthcare professionals to combat medical misinformation in the society. We have 50 healthcare professionals, not only doctors, we have pharmacists, we have paramedics, we have dietitians, doctors from pediatrics, internal medicine, emergency department, and also the family health physician. If you are not familiar, the person at the center with the blazer is our Director General of Health, Dr. Noor Hisham. So why is social media so important to us, especially in Malaysia? According to the Internet User Survey 2020, 88.7% of Malaysians are actually Internet users. We have around 32.4 million population in 2020, and almost 89% of them uses Internet. And in a special study done in 2016, it was noted that these are the common questions with regard to health. So 91.4% of users would look up for symptoms and diseases, and also 83.5% would actually seek out treatment and places to get treatment with regard to their health. And when they read something online, this is the most worrying. 80% would mostly trust, while around 11.7% is neutral. Meaning here is whatever they read on media, on social media or on the internet, they would mostly believe it 100% without any issues. So this comes the problem whereby there are a lot of quacks out there who disguise themselves as healthcare workers or doctors to give out a false or incorrect medical and health information. So these are the issues. 90% of Malaysians are online. Most of them use Facebook, and most of them will believe anything that's been shared online. So the impact here is, this is one example of a health product ad on Facebook. So it's mentioning that insulin is toxic, and it has studies showing that mortality rate increases by 279% with insulin. And at the end there, they would ask the readers to buy the product. So these are the issue, because it will create a lot of health issues. A lot of people won't be taking their medications and so on. And also in 2019, vaccine hesitancy is listed as one of the top 10 threats to global health in 2019. So as mentioned earlier, vaccine hesitancy, anti-vaccine movements, they are very rampant on social media. So this is where they share all their ideologies, all this misinformation and disinformation to make sure that no one takes the vaccine. So this can be an issue. It has an impact, a negative impact on the public health sector. Why do Malaysians believe in misinformation, and what's the appeal? So because anecdotal evidence sells better than factual evidence. Regardless of whatever we say, regardless of whatever data, analysis, papers, and studies is out there, they will always believe their uncles, their neighbors, uncles, daughter, grandfather, or whatever, other than the proper person. And doctors wouldn't have the same impact compared to whoever is telling this grandfather story. And social media enables misinformation to be shared very quickly. It's just at the end of your fingertips. So people most of the time would share something without even thinking whether it's true or not. They will share it regardless of the fact, evidence that they have. They just share it and whack everything. So during COVID-19, we have noted that misinformation is something that's really, really bad.
I don't think we can hear the sound, at least not on my side.
Oh, you can't hear the video. Oh, okay. I think I'm not sure how it goes, but that was the DG of WHO mentioning that we are not facing just a pandemic. This is back in 2020. We are not just facing a pandemic, but we are facing an infodemic, whereby information, regardless whether it's true or not, is flooded via internet, via social media, everywhere, and people have a difficulty to know which one is right and which one is wrong. Then thus it creates a lot of confusion, and all this misinformation, distrust, and everything will set in. During the COVID-19 era, during the times of 2020 to 2022, these are the most common coronavirus conspiracies about miracle cures, New World Order, Bill Gates, Batsup, and all this. These are the things that's going on all over the world. And as mentioned earlier, all these issues would be a difficult task as a public health, if public health practitioners, because when these things are being shared, all this misinformation being taken wholeheartedly by the community, it really makes it difficult for us to push the vaccine. So it was the same thing happened in Malaysia, whereby Malaysians during the rollout of the initial vaccination program, we have something called the Program Imunisasi Kebangsaan, or National Immunization Program on COVID-19. The rollout initially was very, very poor. Thus, the government had to do a lot of engagements with the community to make sure that everyone understands about vaccine. Once that something that made everyone became aware about the importance of vaccine was when our numbers of deaths increased tremendously during July 2021, when people saw the impact of COVID-19 itself. Then people started to believe that COVID-19 is real and the vaccine is in fact effective. But that took a toll in terms of the numbers of deaths. So it is important to, as mentioned earlier, pre-bunking is very, very important. And that's why an NGO like us, Medical Misbahs Malaysia, we try to conduct all these engagements via social media. We conduct talks to the public, to the community. We use FB Live, Facebook Live was very useful during that time, because we managed to engage with the community. People who had questions, they would either direct message us through our portal, or they would also put down their comments during our Facebook Live sessions, where we could answer all their questions, all their theories about vaccines or COVID-19 there and then. However, although social media, I consider myself as someone who uses social media every day. We are sort of an influencer ourselves in terms of the medical field. However, we have to take note that social media actually amplifies infodemic. Social media actually makes a lot of things become worse. One of it is because something called algorithms. I'm sure any one of you who has suddenly wrote down something on Facebook about buying the latest iPhone, and then suddenly you get a message pop out about ads about getting the latest iPhone. The banks would offer you some sort of loan and all that. So these are all because of algorithms. Algorithms will determine what you read and see, but not the factual thing. So meaning that if you are inclined for something like vaccine causes death, or Bill Gates is the leader of the New World Order, then you will get deep down into the rabbit hole. What you see on the news feeds would be what the algorithm thinks that you want to see, instead of something that is factual or something that you need to see. So you are seeing what the algorithm wants you to see, not really what you have to see. So when this occurs, it creates an echo chamber whereby they will amplify whatever misinformation that they are saying. They would be grouped together with some of their peers who have the same understanding. So this will create an echo chamber and also a confirmation bias. So this would go on. It will be a cycle where people would share something, they read something about something fake, something misinformed about vaccines and stuff, and then they would share it with someone, and so happens the one who read what they shared is someone who has the same mindset, who has the same understanding, and this would amplify. and then they would consider that what they are saying is true because it's so fast, because they're getting the same thing over and over again. So these are the challenges. Although we can use social media, but you have to recognize there are challenges that it's very difficult because we have tried to work with some of the platforms such as Facebook, but the feedback from them, the response from them is actually quite not so good, I must say. So in the end, all these platforms, they focus on their business, fact, information, government sector. It doesn't have the same funding compared to those who are selling stories, selling quack medications, some weird medications that are not backed up by evidence. So I leave it to that. I think it's just a very short and very light presentation. I think we can focus more on our discussion later on. I think it's more important for me or for us to entertain whatever questions you have regarding social media and also how we can use it in the public health setting.
Thank you, Ahmad. Are there any first questions from the audience? Remarks, maybe?
Yeah, I guess I'll chime in. That was very interesting. I do, it really resonates with me, this idea of how the algorithms on social media platforms create these types of information bubbles that are hard to break through. And there's all this, you know, repetition of incorrect information in some of those spheres. And you know, one way to try to break through is to invest money in paid social media posts. But it is one of the challenges when we talk about who the movable middle is. Those are typically people who also have their information bubble does not just include entirely conspiracy theory driven content, but how do you break through to those people who are, you know, just closed to vaccination? That remains, you know, a real struggle. And what can the various platforms do to you know, try to create some change there? I think, as you said, it's their business model that's sort of in the way of breaking through those echo chambers. So
it's very difficult to penetrate these people. Yeah. One such approach that we can use actually, because social media is so. If I'm not mistaken, the earlier speaker in the previous session mentioned something about people on social media should try and be anonymous, shouldn't expose themselves. But compared to that method, what we are using for Medical Mustasa Malaysia is we are out there. Everyone knows who I am. Everyone knows that I am a doctor. I'm working as a government officer, because we think that people need to know that I am no quack. I am not some keyboard warrior, an anonymous person working with the Illuminati or something. So they need to know that I'm here, I'm present, and they can ask any questions. So this moment, what I'm looking for making
picking up a little bit. Sorry,
Sorry?
I think it broke up the end of the sentence.
Okay. I think did you guys get the part about creating champions?
Creating champions.
Yeah, so we should create champions who can talk to the community and who are actually mentally equipped. Because social media, I can tell you, the cyberbullying is really bad. I mean, I've suffered from mental health issues for quite a while, so there will be ups and downs. So you need a group of people to help you when you are mentally down. You've been bullied all this while. it's good to take a step back and get your colleagues who are we have the same minded beliefs and also the same objectives to come and take over what you have brought forward.
Yeah, I know Liana and Mari have the delegate from Mali has a question, but I actually think this resonates with another question that's been posted in the chat, which asks, Ahmad, how do you deal with the comment section and the social on the, on your Facebook page? Because that's
so for us, for me especially, once the questions become too personal, or when they start to comment on, oh, you're a doctor, but why are you so fat? So I tend to just block them, because for me, if you can't gain anything from what I'm sharing, you have no point in following or reading whatever I write. Yeah, okay. Because that's my wall of protection.
Yeah, that resonates with what we got from the doctor who intervened this morning. It's don't engage. Liana, sorry, what's your question?
Hi, everyone. Thank you so much for both of your insightful presentations. I had a question which is more looking towards the future. Say there is another new epidemic or pandemic. I know that April, you mentioned about being more proactive. I think we were very reactive during the pandemic, which was natural because it was something very new. But what measures do we put in place as public health professionals to be more proactive going forward, knowing that social media is, likely here to stay, and just how can we be more proactive going forward with any new pandemics, or even just health issues that arise within our populations?
I guess I would say, that people, organizations, individuals, depending on what your audience is, should really work to create a process that they can replicate that really elicits the questions from the community, from patients, from individuals. And that can happen on social media through a number of social listening tools, but it can also happen through kind of boots on the ground communications and engagements with various stakeholders. So I think really getting a good and early handle on what are the questions, what are the concerns, and then working, having a process where you can quickly generate informative and plain language. I think that's kind of key, because a lot of the information around vaccines is quite complicated for a lay audience. So how can we work to really translate science for lower literacy or health literacy populations? And then I think on social, because as we're discussing these kind of echo chambers, I think an investment does need to be made in paid social posts that try to break through some of those echo chambers. And then I think there continues to be pressure on the platforms themselves to do a much better job of, kind of regulating and interrupting, especially as I mentioned, in the US, there's, 12 individuals, organizations that generate the vast majority of the content. So the bad actors are known. And so identifying those individuals and then having the platforms hold them accountable, I think is, one of the really important things that could happen. But from a public health practitioner perspective, I think the notion is to have a repeatable, process in place that can work to pre-bunk, essentially inoculate people from the misinformation that will be coming. And so that's kind of my thoughts on it.
Thank you so much.
One way forward, I guess, is what I think I need to congratulate the Paris WHO team for conducting this the program, the event, because this is the way forward. Because without us knowing or recognizing that misinformation is a problem, then we can't move forward. So whatever we're dealing with later on. So the best time to be prepared is when there's peacetime. So that when there's another pandemic, we'll be there ready then. So I think what WHO is doing, CDC is doing, they have their infodemic manager training. So this is something that everyone should look into, because we have things that, as mentioned by April, it's a proper process. We have the social listening, pre-bunking, creating content, and how to analyze what's going on and how we can improve further on that. Yeah.
Okay, I think we have a question from, I'm sorry if I scorched your name, Adekite.
Yeah, thank you very much. I think you did a good job trying to pronounce it.
Okay,
yeah,
cool.
yeah. So thank you so much to both speakers, for Brabuch and Dr. Firdaus. I really learned a lot. I have a question for Dr. Firdaus, and that is, from his experience, like, which of the different media platforms has like the highest prevalence of this misinformation? And I just wanted to also know about how his team actually operates. So do they just have their own accounts where they do things, or are they spread all over different media platforms, doing different things? And then the third thing would just be, what do you think about building an algorithm that actually maybe from the start sorts out, kind of misinformation? Because I think of it as, if the different platform owners can actually create algorithms that show you something, can we ask them to create algorithms that show the right thing or something like that? Thank you.
Okay, thank you, Adekite. I'll answer about the algorithm part, because I have no answers to that, because this is something that's beyond what I know, because this is something to do with algorithms, the technology part. One thing that needs to be stated is in terms of what we call social listening. Social listening would depend on where we are located. I cannot use the technology or the social listening tools used by my colleagues in Europe, because we have terms here that are not the same. In Malaysia, they don't call vaccines as vaccines. They have other terms which are quite different and would require a different set of tools. So one may not work throughout the world. So this one is very difficult to deal with. We need someone who is in the technology field to answer that. In terms of how Medical Mythbusters do what we do, so for us, we have, each person has their own social media profile, and we would write something on our own Facebook page, Facebook profile. And then it's something that is it's interesting to be shared to everyone. Then we would screen through the content, we make sure it's nice and tidy, the words are proper, then we post it up on the Facebook, the main Facebook page. So it has multiple layers. So I actually value all my colleagues who do not use medical terms. Our approach is storytelling. For example, a normal doctor would say, okay, depression, major depression disorder, you have to have 2 weeks of depression, you have to have this and that, you have to follow DSM criteria on that. That won't work. But if you say, oh, yesterday I met with a patient, which should not be, I mean, we, of course, we have to make sure that all the contents are privately protected. So we have something like, oh, recently I met with a patient, a person who has difficulty working, and then when I explore further, then it seems like she has depression. So this is what I do, and this is what you can do. So it's more like a storytelling approach instead of the facts that you just work. With regards to the social media platform, actually it would depend on the demography. For me, because I am at the age group of between 30 to 40, so we would use Facebook more. For those who are in the younger generation, 35, maybe 20, they would use Twitter. For the younger ones, they would have Instagram and TikTok, whereby we are trying to penetrate that field, trying hard. I wouldn't say it has a lot of success, because to be frank, those who in Instagram, in TikTok, are the ones who they are endowed with some beauty that not all doctors have. So yeah, something like me who's not that handsome would be difficult to go to on Instagram. So yeah, it has to have different profiles, different demographics.
Different. Well, thank you so much. Thank you so much. That was insightful.
I see Joy has a question, but just before I give you permission to speak, we also have a question from the chat, which is technical, which is, do you think it helped to have Medical Mythbuster exist before the pandemic started? Because you were launched in 2016. Did that,
yes.
take advantage?
It really helped because we know what to do beforehand. We know what are the social listening tools that we can do. For example, actually in 2016 there was a diphtheria outbreak. I think it happened all around the world. America, the US had chickenpox, measles outbreak, and all that. So these anti-vaxxers actually mirror the ones in the US. So we had the same issue where before this, even I myself have never seen diphtheria in my life. But suddenly, because of the loss of the vaccine, the herd immunity isn't there. So we had around 5 deaths caused by diphtheria. So that pushed us forward to create Medical Mythbusters later. So with that experience, it built up our experience to face the pandemic.
Okay, great. Thank you. Joy.
Hi, everyone. Thank you very much. This is really an interesting program. And my question will still go in line with what Adekiti said. I want to know if there's any plan to partner with some advocacy groups in order to roll out a program that will target at-risk populations. There are some population that is really at risk of this misinformation and disinformation. Is there any plan to partner with advocacy group? And also, is it possible to speak with these network providers, Facebook, Twitter, at least to be able to roll out contents that people would really, they are the ones, if you click on something, they're the ones that will be feeding you the information you want to hear, okay, you want to know. Okay, if there's any way to partner with these people to have a strong meeting with them, if anybody that goes on Twitter, Facebook, they will be able to see content that will direct them to the right source, that will enable them to get the right information. Thank you.
Yeah, maybe I can take a stab at answering that, at least from the US perspective. We did meet regularly with the major platforms like Facebook and Twitter and others. And they did make efforts to both donate paid media and to provide accurate information about COVID vaccines and accurate websites. However, it was in no way sufficient enough to overcome the misinformation efforts that were happening at the same time. So I wouldn't say that they hadn't done anything, but I think the main recommendation from kind of NGOs in the field is, again, deplatforming bad actors, but sometimes that runs kind of antithetical to the sort of ideologies of the platforms themselves, which are sort of a free and a free speech kind of marketplace. So there's a lot of complex issues. But again, I think public health NGOs and related believe deplatforming bad actors is a very important thing that the platforms need to do. And then, at least in my experience, there has been a lot of collaboration with NGOs, community nonprofits, what have you. We've worked on the national level with a number of at-risk population national organizations, and then at the all sorts of, both funding and collaborations are happening at the local and community level. I think that, I think I was mentioned, like, it's not a either or, it's like we need interventions and conversations kind of at all levels, at the local community level, at the state, at the regional, at the national, and at the global level. So I believe that's, that is all happening and is important.
There's oh, sorry, I didn't want to interrupt, Matt.
I think we can actually see, I think this is from the colleagues in the US, whereby we can see some of the actors played down or banned it from Twitter. And also on Facebook, we could see there's this tag whenever someone mentions the word vaccine or something. So there's a point there mentioning, okay, vaccines is something. I think this is where you can reach out either CDC or any Ministry of Health. So I think that one is a good move. I think that one was led by the colleagues in public health team in the US. On top of that, I think compared to all these other platforms, I believe from what I see from my experience, Google is actually the one who is, we can see that they are doing something, at least for the Asia Pacific region. On Tuesday, I'll be heading to Singapore, whereby they have this Trusted Media Summit, where we could actually, medical personnel, journalists and all could actually get together and find or figure out some ways to make sure that what is being presented or what is being shared online, on Google, on all these platforms actually, we can come up with something to make sure that what is created is something that is factual and is true.
There's a question in the, I mean, actually, I'll take, Ronan will take your question and then we'll go back to free speech because there's a question in the chat.
Okay. Thanks so much, Ms. Chair. The COVID-19 pandemic has brought the world down into its knees, and I think I wish not to devalue the mental health issues of the community around, since we might face another pandemic in the future, and I want the stigma to be removed, and I think that's really important to have a resilient community. How would you? I have a question for Ahmad. How would you encourage people to remove the stigma on seeking mental health profession and make communities resilient in preparing for the next pandemic? Thank you.
Oh, wonderful question. It's actually in line to what we are doing at the moment. Tonight, actually, we have a Facebook live session with our partners and NGO partners, whereby we are creating a webinar for the public to attend. So in terms of stigma, it's very real. I believe it occurs everywhere. In Malaysia, it's particularly quite bad, and we have seen mental health issues on the rise with the pandemic. So what we are looking out for now is instead of we are being too active in educating, in giving out information of some sort, what we are trying to push now is to make sure, for example, in the Ministry of Health Malaysia, we have something called TALK, talk, let's talk. T is tell someone about the problem, ask someone to help, listen attentively to your partners or your friends, and K, know where to seek help. So these issues is we are empowering the public instead of just the health side educating, informing. We want the community to be aware that you can seek help and this is where you want to seek help. So it's a way forward. Instead of us preaching, this is something that the community, okay, this is what you can do. We teach our champions to do that so that everyone else can know where to seek help and make it normal to have a mental health problem.
Thank you, Ahmad.
Yeah, thank you. I'd like to go back actually to social media algorithms. We have a question about free speech, because this is in the chat, asking for comments on free speech in the chat. And I often think that actually the free speech argument is personally, doesn't make sense because, you know, it's like, it's social media space is space. In a city, you don't build anything where you want to build it. You take into account the effect it will have on other people. So maybe changing the way we look at social media could help. What's your position on, you know, maybe the corporate social responsibility of these big social media platforms? Like, should they be more tightly regulated? How can we do that? What should we expect from these tech giants in the next few years? Should we be expecting more or not?
I'm not sure that I should probably speak on like potential regulation, but I think, yes, you're right. I mean, this is, these are owned properties, so the free speech notion does not apply as it does like out in the marketplace, out on the street, at least in the US. However, you know, the platform owners largely want to maintain them as such, you know, as these like open marketplaces. So there's been, as we all know, some resistance to kind of regulating dialogue and, you know, deplatforming individuals. You know, I believe, have done more over the years to define and document their sort of terms of agreement, in meaning like what people aren't allowed to say or can't say. But I believe, at least in the US, there's continued pressure to, you know, have more monitoring regulation of hate speech and you know, like, for example, you know, vaccine misinformation that could lead to, you know, really bad health outcomes. So there seems to be like some progress in the area, but I'm not really sure. And I'm not sure I'm the right person to speak to what the, you know, the next years might bring in terms of regulatory approaches.
That's at least something really difficult to say what will come out in the future. Recently, I watched on Netflix The Most Hated Man on the Internet, or some sort. So you can see that as long as there's a demand for it, as long as there's people seeking out all these rubbish facts, misinformation, there will be another platform that will take up that opportunity. It's a business model that can make them rich, so they would go up. We have seen in the past, we have seen Friendster. Where has it been now? So maybe it will happen with Facebook, whereby they create something up which appeals more to the community. If they want free speech, then that's what they will get. From our side, the public health team, public health practitioners, I think we need to continue on with our education and empowering the community, because we cannot keep on preaching. We cannot keep telling people on what to do. We need to tell people that this is how it is. This is your choice. It's up to you to do the right thing.
Yeah, that's interesting. I was thinking, you know, how, like, rather than censoring people, how do you create a space where you're sure people will encounter at some point the right information? But I guess then people will have that same bias against the fact that it will be government-induced information. So you're just perpetuating the issue. But yeah, any other questions? Thank you for your answers, your frank and honest answers. Do we have any other questions from the audience?
Yes. Okay, my question is, I wanted to type it, but it's like I will be very slow doing that. My question goes like this. I know that almost all of us are public health officers. I'm one in the making. Okay, I'm like, are we all going to be content creators? Okay, in order to saturate the social media, or are they going to create misinformation workers that will be targeting, you know, that will be there all the time? You know, it is important to engage the the people that are saying yes, or the people that are commenting, it's important to engage with them, because if they're being directed to the right place to get the right information, I think they will be more informed. Like what happened during the COVID will not be able to happen. They will be more enlightened. Nobody will say, don't take vaccine. Vaccine is gonna kill you, and they will accept that. So I am like saying that, are you guys going to create misinformation workers that will be like I'm sorry if I use the word attackers, that will be like pests. Now, I don't know how the kind of word to use that will be that will enable me to pass my information, but social misinformation workers that will be on the internet targeting these kind of sources that where the misinformations are coming from. I don't know if you understand me. Sorry.
I think the term we're trying to go for is cyber keyboard warriors or something, right? Keyboard warriors, I think. I'm not sure. May I answer your question straight away?
Okay, I said, are you guys going to create a misinformation workers? Okay, they will be basically on the internet, targeting misinformation, replying, trying to pull it down, not trying to dilute it.
Yeah, so I think ask a question of whose responsibility. Do we have a specific status for people dealing with that? As Adekite terms them in the chat, cyber warriors? Or is it like individual?
Yeah, I guess from my perspective, it's all very resource dependent, and most public health entities don't have like the funding to set up, like, I don't know if you're imagining like a room full of people with computers, like, you know, combating the misinformation day in and day out. But I think, again, depending on resources, there are, you know, individuals within organizations who are responsible for monitoring and managing, kind of working that process that I had laid out, and that I think Ahmad does as well, in terms of monitoring and performing social listening, you know, helping to produce the content and then placing and tracking the content. So I think there are people that do that as some or, you know, some portion of their jobs. And it really just depends on the organization's, you know, availability of resources, which we know are somewhat scarce in the public health domain. And I think, Ahmad, didn't you say there was like infodemic training happening at CDC or something like that? So it sounds like people are kind of getting trained up on the notion, but I don't know that there's, you know, resources to have like the room of health misinformation cyber warriors, but it sounds kind of cool.
About the WHO infodemic management. WHO has a training program at hand. They collaborated with CDC, and I'm not sure how if it can be open to everyone, but they have the mini courses on WHO Open that you can attend to. You have the basic things that you can start off with. However, in terms of, I totally agree with you. It's very resource dependent. As for me, I'm not supposed to touch my phone during office hours. So for that period, I won't be able to respond to any comments or any questions. So it's totally resource dependent. However, we do take note that sometimes it has to be what is it called? Organic. In social media, there's a term called organic. So every comment needs to be organic. It cannot be something that looks like a robot trying to answer that question. So it has to be someone coming up from the right person, is an actual person, then people will actually engage better. However, it's very resource dependent. Even at Mental Health Malaysia with 50 people, we cannot tend to each comment one by one.
We're coming to an end. We have 2 minutes. I just have one last technical questions for Ahmad, actually, on that notion of resources. How are you getting your funding as an NGO? Like, where is it? Who's funding you?
Surprise. We're not funny. We're a very poor NGO.
Okay.
We do a lot of things for free. I don't know why people ask me why you do it for free. It's just what we do. I think it's something that it gives us some sort of fulfillment. That it makes us feel good. That's it.
Yeah. Okay. Well, yeah, it makes sense. It's always a big debate. Like, you know, voluntary work needs to exist, but people should also be getting paid for what they're doing for the world. But that's another topic. Unfortunately, we have to call it an end. I think we're just gonna take a quick picture to remember this moment. Thank you so much for your insights, both of you, and for the conversation from, you know, two different sides of the world. Tiffen, are you okay with taking the snapshot? Or I mean, I can take it also.
No, I can take the snapshot. Thank you so much. So I'm gonna ask everyone to maybe open their camera for a little bit so I can take the picture.
Yeah. Thank you, Ahmad and April, for a very interesting and insightful conversation.
Thank you.
Thank you, April. You've been insightful.
Yeah, I feel like I learned some
so
things
much
too.
so insightful.
Also nice to see people's faces. So.
All right, done. Thank you, everyone.
Thank you everyone for your time and effort.
Thank you, Ahmed. Thank you, Professor April, and thank you, Laura, for moderating this session. It's a very engaging and amazing session for us.